Three most important things that you need to know before you start recovery from opiates or alcohol. The first one is withdrawal, the second is a relapse, and the third one is overdose. And this one is very scary because people are dying. And now let me explain you how you can choose the best recovery to make sure that once you go through this recovery, you will stay clean, you will stay sober. Let's start from withdrawal. To protect yourself from withdrawal, the best option will be buprenorphine, and there is a very specific reason for that. You see, different opioids, different options, they stimulate your opioid receptors 100%, which means even if you go through withdrawal, you still can get high, but not with buprenorphine. Buprenorphine is a half antagonist, which means it's not strong enough to get you high, to stimulate your opioid receptors so much, but it's strong enough to take you through withdrawal without agony, without pain, without suffering. So you don't need to think about how you will survive next hour. It will be strong enough to bring you peace, to bring you that, to take you to this calm place where you can actually go through withdrawal, but it will not make you high. And buprenorphine needs to be dosed only as a patch. And there is a very specific reason for that, because no injection and there is no pill will give you stable dose 24 hours a day. Only patch can do that. And with a patch, it's very easy to taper off, to taper down. And we found through our practice over many years, this is the best way to get someone from opiates or alcohol, to get this person clean without withdrawal. So let's talk about now relapse, because once person is clean, there is 80-90% that this person will relapse. And for this, the best is naltrexone. You may ask, why not anything else? It's because naltrexone is 100% antagonist. So you go from buprenorphine half, like 50% antagonist, to 100% antagonist, which means now naltrexone is going to block your opioid receptors. What does that mean? It means that there is nothing that can attach to these receptors anymore. So even if you want to try the drug of your choice, the substance of your choice, or alcohol, you're not gonna feel anything, and your brain will start learning that alcohol or any other substance doesn't give you any pleasure at all. So you start actually recovering right now. You don't need to worry anymore about cravings, about everyday fights and thoughts. You don't have to escape from anything anymore because you don't feel nothing towards any substance anymore, which is actually very powerful, because only once person is taking naltrexone, only then this person doesn't go through pain and start becoming receptible for all the information recovery and starts rewiring brain. And the third option, overdose, it's also naltrexone. You see, naltrexone, it's so powerful that protects from relapse and overdose as well. So if there is no any cravings, probably you're not gonna use anymore as long as you take naltrexone. What does that mean? Even if you take anything, you're not gonna feel anything, which means you cannot overdose anymore. So if you take any opiates, something like Suboxone or any other substance, you're gonna be safe. You're not gonna overdose, which is actually very huge. But here's the trap. A lot of people are taking naltrexone in the form of tablets. Trap is actually very weird but very simple. A lot of people start feeling too good taking naltrexone, and then they decide, okay, I feel pretty good, I don't need to take it anymore. They stop it after a couple of weeks or a couple of months. But rewiring brain takes up to 7 years. So they need actually a lot of time for brain to be rewired back to normal, so they will have not cravings anymore. Once they stop taking tablets, they feel cravings, they go back again to their addiction, they start using again. There is a different form of naltrexone, which is actually injection, called Vivitrol. But the problem with them is that the first injection will work 30 days, the second about 28, the third one maybe 26, and on and on and on. So when you take injection number 11 or 12, it may work only 11, 12, maybe 13 days. And that's a huge problem, because you become exposed again on cravings. But there is a new solution, and it's actually a very good solution. It's naltrexone implant. Once placed in your lower abdomen, it protects you for about up to 15 months, which means there is no daily pills, no injections, nothing that actually could cause relapse, nothing that could cause cravings, and you protect it for all the time, and you have a time to go through recovery and actually rewire your brain, which is actually very powerful. So if you want to find out how you can get access to this naltrexone implants to make sure this is going to be your last recovery in your life, comment free and I will text you with information how you can get access.